So what inspired EHA Clinics? I co-founded an organization about 13 years ago called eHealth Africa. It's a nonprofit, and we've been working in Nigeria for several years at that point. We were a public health NGO. We wanted to make sure our staff had the best access to healthcare. We sought out the best health insurance plans and paid for the premium health insurance plans and did all these things to make sure our staff had access to healthcare. But then what we realized is that even though we were paying for that access, our staff were still suffering from poor quality care. I mean, we had, I think in 1 year, we had like 2 or 3 staff that had passed away. We had to look for a better solution. And we had all this experience in the healthcare sector. So we thought, okay, what if, we created a new company using our experience in healthcare in the private sector. The kind of some of the final pushes actually came down to a personal thing. My wife got very sick in Kano, something that shouldn't have been major. It was, eventually diagnosed as appendicitis, should have been able to deal with. But we went all around Kano. I knew every doctor in Kano, went to all the private places, couldn't get her an ultrasound, couldn't get her proper care. At one point she was admitted, and instead of giving antibiotics, they're giving her morphine. And eventually it got so bad that she was either going to die or we had to get her on a plane. Luckily, we had this international insurance that paid for her to be medevaced out of Kano, but medevaced for something as simple as appendicitis that could have been treated had we just had the right things in place. And so after that whole experience, even taking her to the airport, we needed an ambulance, getting an ambulance in Kano. The one that showed up was this old 1950s truck that could barely move. And so I ended up having to drive her myself, begging the people at the airport to let my car, let the car onto the tarmac so we could get her. And I came back from that, and I just went to our board, and I just begged them. I said, "We've had this plan to launch the clinics. We need to do this. People are going to keep dying if we don't do this." Yeah, well, I mean, we're going to have to see what we can do. We need to make this thing work.
EHA Clinics was established in 2018. Its major goal was to bridge the gap when it comes to healthcare services by providing quality healthcare services to serve the community.
First of all, the desire to drive towards quality and patient safety and customer satisfaction is all driven from the top, the management, the leadership team. And our CEO, Adam Thompson, took on board the desire to drive towards pre-qualifications, etc. So it was from there that everybody accepted the concept of driving quality and patient safety and looking at the customer, the patient, and how we can improve.
From all your complaints, I would just have to go and check and have a good examination of your mouth and know what's going on there. Is that good?
It's not about just letting people talk to a doctor. It's making sure that there's an entire infrastructure and systems that support that doctor to make the proper diagnosis, give the proper care, and then follow up to make sure the patient is having the appropriate outcome from that care.
We need to cut off that excess gum that is covering the last teeth so that the teeth will be exposed.
For JCI, it's a total team effort because everybody has to be on board and have the same aspirations for quality throughout the organization. And it's a continuing process of training, of education, and as I say, improving on the improvements. And it's driven by the management, right from the top, from the leadership team, right through departmental heads, through managers and people within the organization. So we're in communication with everybody. We have very open management follow-up meetings on JCI audits and improvements to make sure that everybody understands their part within the process.
The journey for EHA Clinics to the JCI accreditation, so for Joint Commission International, we started this process almost from day one. We knew from day one we wanted to follow a quality framework. It's kind of like standing at the base of Everest and looking up, and you just say, okay, this is going to be a long journey, so we need to kind of set the framework for how we're going to get there. And we had a lot of kind of stops and starts where we kind of got the process going, and we realized, wow, we can't even continue with this because there's a bunch of stuff that we need to then put in place before we can even continue on. So we had to rethink our whole recruitment process and say, okay, we need people not just with the technical skills, but with the mindset around quality the willingness to do teamwork.
JCI accreditation was a long journey. Major highlights are the teamwork that we had at EHA Clinics. Every single team member at EHA Clinics participated to have this accreditation done.
I think you have to look at primary health care as a gatekeeper. Failure of primary health care is what results in people having to go for tertiary care. Making sure that our hypertensive patients are now coming down with situations where they now need, put in a stent and things like that. I think that is the place where we can win. Nigerians make a very large part of most of the established Western healthcare system. So obviously we're doing something right. We are bringing up healthcare staff that people want to recruit from Nigeria. So we're definitely doing something right. So for all the people who are running to the UK for treatment, your nurse is probably going to be called Biola.
Hey dear, how you feeling? Okay, can I just take your temperature? Here we go. Boop. Boop. Oh, that's all right. Should be okay. All right.
At EHA Clinics, we make sure that we purchase top-notch equipment that can offer a wide range of services. So we have calibrating plans, we have maintenance plans that we use to ensure that at every point in time, patients are confident that the records that they have with us are accurate.
In terms of quality at EHA Clinics and the level of quality that any patient expects to get, it's one of our core values. So, and one of the things that we monitor closely to ensure that when patients come in here, they're safe and that their care is reproducible.
We looked at the entire system of what it was going to take to deliver quality care, and we kind of built that from the ground up. So when we started EHA Clinics, we even looked at the facility itself. How do we actually get a proper facility that has things like air filtration built in the air so that as sick people come into the clinic, they're not spreading their illness to people sitting next to them. Quality is not an endpoint, it's a journey, and it's a constant journey. So you can't ever say, okay, well, we've reached quality, now we're okay. It has to be this continuous improvement. So we invested a lot of time and money in making sure our staff became certified by the WHO.
We want to ensure that we are implementing quality systems throughout our organization, right from our primary healthcare clinics through our pharmaceutical distribution and every element of the business that we expand into. We are looking at development and opening new clinics in Abuja, in Lagos, and also in the East.
So what does the future hold for EHA Clinics? The future of EHA Clinics is really to access affordable, quality healthcare. If our dream came true, we would be in it. We'd have at least 50 clinics, in the next 5 years around Nigeria. We want to open up access to other parts of care, not just focus directly on the kind of primary outpatient care. We're looking at launching services to give people access to mental health, where that they can access their mental health and get counseling directly on their phone or on via a website. The minimum standard of care should be access, affordability, and quality.